we're starting our journey with someone, I believe, who actually does not accept status quo and who wants to see progress as such in his organization and more widely as well. A very warm welcome again to the President of the ICRC, Peter Maurer. So what I would like to do with you is basically ask you a number of questions, of course, questions that very much derive from recent research that we have carried out as HERE, and get your reaction basically as an input and something that will also inform our thinking and our conversation in the coming days, really. Again, welcome, Peter. The COVID, in the background note that you and others may have read, we particularly say something on how this pandemic has served or acted as a stress test for the humanitarian sector, just perhaps as the financial crisis did for the banking sector 10, 12 years ago. So what this pandemic does, it sort of shows what works and what does not work, and it particularly amplifies or magnifies existing gaps as such. And I believe also that is what you have pointed at in some of your statements that you have made since March last year. Perhaps you could provide us with some examples of what you see as the effects, particularly of COVID-19.
Well, thanks a lot, Ed, and colleagues, for having me, and I'm happy to dive into some of those questions that you have mentioned, also originating from your research. Let me maybe make a first point with regard to stress test. While I agree that it has been a stress test for the system, it has first and foremost been a stress test for so many societies in which we work. And of course, as a frontline humanitarian organization, very much working in fragile contexts, we have been increasingly preoccupied over the last decade, I would say, about the confluence of protracted conflict elements into highly fragile situations, which are very difficult to manage. We just don't have violence as a standalone problem in society. We have it combined with governance, with poverty, with impact of climate change to society, and we have pandemic on top of it now, pushing and putting a lot of pressures on society, either directly by challenging the health systems or indirectly by the measures taken to deal with the pandemic. So maybe my first point is that the stress test has first and foremost been with many contexts in which as humanitarians we work. Then because it has been a critical issue for those society, as you rightly said it, the sector has also struggled to deal with the amount of challenges, with the gap, with the gaps between needs and response capacities of the system, the funding gaps, the attention gaps that we have witnessed. I think it has challenged some of the critical polarities of humanitarian response, the component of international part of the response compared to the local part of the response, and how would we find in a sudden interruption of logistics, communications, as we have seen them through pandemics, and how would we find a new deal on bringing international components and national components together. It has shaken and has put some stress on the whole mix of assisting people, mitigating the impact of violence, conflict, natural disaster, whatever the humanitarian origin of the needs are, and our efforts to prevent, to change behavior, to protect, as we would say in many organizations. We have, as you said, Ed, in your introductions, we knew that we would be at the beginning of a digital transformation of society. But as organizations and as a system, we definitely haven't been prepared for the virtualization of humanitarian assistance. And so if we remember well, what has been the 10 last years, and I say it because 10 years because we have just commemorated 10 years of the Syrian conflict, and the Syrian conflict has been one of those predominant features over the last 10 years. And we have been bogged down and preoccupied about access. But the digital transformation has highlighted also the importance of accessibility of our services and has given new potential to look at some of those dimensions. So these are just a couple of highlights where indeed, as you rightly say, whether we speak about funding, whether we speak about response and mixes of skills and capacities, approaches, we have been heavily disrupted by the pandemic. And I think it has been a major stress test. On a positive side, and without making now undue publicity for the Red Cross movement, but I truly have been impressed also how our colleagues in the field remembered what proximity means and how much we have managed to stay where we were. I think from many humanitarian organizations, we have been the one instructing our people to stay. We have repatriated 2% of our internationals, and only those who had health issues, all the others remained in the field and delivering. And I think this is maybe also speaking to the truth that while some of the problems in the system became clearer, we also have to acknowledge that some of our basic assumptions to humanitarianism are still valid and can be reinterpreted, adapted, recast, reused, also in a system which is under stress.
So what you're describing is, in that sense, clearly it has had a profound impact, and it really obliges us to rethink also our way of working. Now, at the same time, there are some things perhaps which never change, in a way for obvious reasons, because it's how the system is organized. And in fact, humanitarian response starts with the role of the state. And if this crisis, this pandemic has done one thing, perhaps also, it's re-emphasized perhaps the role of the state in terms of course, protecting and assisting its citizens. Now, at a number of times you have described that, in fact, clearly governments have even in the obligation of protecting their citizens also, of course, have the prerogative to restrict the freedom of movement and so on. So to put limitations perhaps on certain fundamental rights and freedoms, but there are limits to that. And what you particularly said, and I quote, these restrictions, these emergency restrictions, are not a free pass to circumvent the law. That really brings me to a question in the sense of how you see the role of humanitarian organizations in reminding the state of their obligations, but perhaps also in that sense of the limitation that they need to observe when they impose these restrictions.
Well, it's a big question to ask me about the humanitarian system, but I can say a few things on how at the ICRC we would interpret that role. First, Ed, let me acknowledge what you also mentioned. I think on the positive side, I have to say that finally a couple of countries discovered that they have an obligation towards their populations, because the pandemic has been an educational pandemic. It has demonstrated and shown to governments that they need to care, and if not, they would suffer themselves, and their power would immediately suffer. So the global character, the intrinsic character of a pandemic has sensitized states about their responsibility. We have seen it, for instance, with a sort of never before seen interest in the detention work of ICRC. Suddenly, that's the first time, I think, in decades that ministers of justice, of penitentiary affairs called up the ICRC to ask whether we wanted to visit. Because there is a state responsibility acknowledging that what is happening in detention may flip over into outside detention, may become a security risk, and so on. So I just wanted to give that as an example of the pandemic as a responsibilizer of state power. And then, of course, we do understand, and with our traditional relationship to state security forces, to the armed forces, to the security forces, to the police forces, in educating, training international humanitarian law, with our continuous engagement with the power structure in order to find the right balance between what the Geneva Conventions call military necessity and the protection of civilians, reinterpreted into the pandemic world, there is a balance to find. And I think a lot of our engagement during the pandemic was really reframing in our dialogue with governments on what the role of the armed forces in public order would be and where the limits would be. It's precaution, distinction, proportionality. It's measures of force respective to expected outcomes. It's those basic ideas enshrined in the Geneva Conventions, which needed to be recast, reinterpreted, brought into the conversations with states who started to use police forces, security forces, armed forces in order to ensure public order during the pandemic, in ensuring that some of the restrictive measures were respected. And so the proportionality discussion is a conversation that ICRC has on a continuous basis with armed forces in combat scenarios, and which we really tried to recast and reinterpret. So what I said in the Human Rights Council and what you quoted is very much a sort of a interpretation and continuation in the area of, and in the dilemma of restrictive measures necessary in order to cope with the pandemic compared to the space you need to preserve in order you have civil society be able to develop. And that's not something which can be sort of easily prescribed. You need a dialogue of trust, and very frankly, I have to say, it is a dilemma which, articulated in the way I've just done it, is not something we had the recipes. When tomorrow we have a battle in northern Ethiopia or in eastern Congo, we have 158 years of experience on how to think about proportionality, precaution, and distinction in a military operation. But we don't have these easy recipes with regard to trade-offs between restrictive measures taken in order to fight the pandemic and civilian space to be preserved so that a society can develop, because too restrictive measures, and we have seen it in many places, would then have secondary effects on the society, which would again loop back into big humanitarian problems. Wherever I go in Africa, and have gone over the last 6-7 months, every minister, head of state, prime minister tells me, my main preoccupation is not the pandemic, is the secondary effect of the pandemic on the economy and the society of the population. So finding this balance in a trustful dialogue and inspired by the law and the practice that the organization has developed over decades is something which was a core activity of ours over the last year.
In finding the balance, which is something you emphasize, clearly we also now look at, and you already mentioned the word proximity, and particularly, of course, the unique role that the Red Cross and Red Crescent movement has in that sense, or perhaps I should say advantage. But clearly there is a balance to be found now in terms of, well, working through digital means remotely, and in fact ensuring presence, direct presence on the ground, not only of, let's say, local, national employees of humanitarian organizations such as the Red Cross, but also, of course, of international staff. And um, I'm curious what you say on that, Peter, in the sense of clearly, because of the limitations on the freedom of movement, the restriction was very much a restriction of the travel of international staff. Yet, I think that there's also still, I would say, but I'm curious for your reaction, that there is still a role to play for international staff working, of course, with local and national organizations and staff. What are your views in terms of how in the future do we find the appropriate balance between what is international and what is national or local?
Well, I'm definitely, as you suggested, I'm definitely of the opinion, and in my organization, I try to push the logic that we are entering an area of where hybrid is the key word. Whether hybrid is between international or national, whether hybrid is between virtual and physical, at the end of the day, I strongly believe that the strength of humanitarian work comes from an intelligent combination of local roots and international cross-sectoral perspective, which only comes from staff able and willing through their careers to look at different landscapes of conflicts and different experiences. And I strongly believe, when I see on where we have been successful and where we are not, that moving the needle into the wrong side, either to too much international or too much local, ends up with big problems. If we go too much local, the big danger which we see each and every day when this trend is followed is, at the end of the day, that we leave local power structures and people exposed to local power structure. You lack the critical outside dimension, which can support those who are marginalized, in order also to confront some of the local power structures. And so you need to have this international independent dimension, third view in a conflict and in a critical humanitarian situation. And if you move the balance too much towards the international, you get this humanitarianism that we have seen in the past for quite a long time, which is somehow uprooted and not really connected to the local communities, to the needs of local communities, who doesn't understand the local dynamics, is not able to operate and to put the screwdrivers at the right place. And so finding these two dimensions is a big challenge. It's contextually different from one place to another. I don't have a recipe on what the proportion and the dimensions are, but you see a little bit where we are at the present moment. Out of 20,000 staff at the ICRC, we have roughly 2,500 mobiles, and the rest are local. And what we have done over the last year in particular, but also over a longer period, is to give more responsibility to the local staff. And we are coming maybe at certain moment to a critical balance now, where we find the right mix of these two dimensions. And the same, as I mentioned, is true with regard to hybrid. And I mentioned in my first response, not only to look for access and proximity, but also to use digital tools to have people access some of the services, because today data, information is a humanitarian good. If I look what we are doing at the present moment with regard to family reunification, missing people, tracing those who have been displaced and allowing them to connect again with their communities and families, this is a digital task. Having a secure channel so that people wherever they are can access also this information stream is a humanitarian work and is an imminently and important protection element of our activities.
So what you're talking about there also, Peter, I think is around basically comparative strengths, knowing what your strengths are, and perhaps also your weaknesses that you need to find or complement, of course, with the strengths of others as such. Now, in my intro, I mentioned this need for honesty and creating a safe environment for having that honest conversation. Last week, I was in a conversation with a number of organizations where actually it was said, well, what it needs for us is perhaps a change in incentive system, in the sense that actually the problem at the moment is no one gets rewarded for stepping back. You get your reward, your funding, especially as international organizations, for getting involved. So clearly, it seems that some of the incentives at this moment, it seems to me at least, they need to be changed as such in order to achieve this complementarity. Do you have any thoughts on that? How to achieve this?
Well, it is really the $100 million question in the humanitarian sector, Ed, and you have been in this sector for a long time, and we have tweaked the words and practices over the last decades around cooperation, coordination, comparative advantages for so many times. My sense today is that maybe also in terms of concept we have to develop. I started to think when I looked at some of the really positive practices coming out of the pandemic, whether we shouldn't talk and conceptualize the multiplicity of factors in a different way. I found, for instance, that the COVAX is an interesting model of cooperation because it brings science, states, humanitarian organization, international organization, the economy, and the private sector around an issue-based cooperation around the table. And you basically build value chains with a view to have an impact at the end. And I think thematic and contextual and multi-stakeholder formats are maybe more interesting and promising to think about in the humanitarian sector for the future than just how organizations with their mandates, credit lines, people think about the future. Because if you start at the level of organization, you try to sort of connect quite fixed entities. If you start to think producing value chains for delivering to people, then your incentive is basically over cooperation with others because you are a link in the value chains and you better perform your role in a chain in order to produce something. You are valued by what you get at the end and not by what you are according to mandate. And I think we somehow need to break. I have a nuance with Antonio, who always said the system is broken and is broken. I'm not sure whether, I think the system is not enough broken. I think in order to conceptualize humanitarian delivery and services in the future, we need to décloisonner in French. You need to somehow break some of these strong international mandates, credit lines, and to inject flexibility so that parts of system can communicate and be interoperable with other parts to deliver services. And I think that's what I have tried to do over quite some time now, also at the ICRC. For instance, CCHN, the Center of Competence for Humanitarian Frontline Negotiation, is really an effort to bring frontline negotiators, not MSF, HCR, WHO, and ICRC and HD together, but frontlines experts, professionals from these organizations, and to connect those professionals in order to exchange experiences, to do better, to somehow enhance the capacity of the sector. So it's a little bit of a different way than the coordination cooperation language that we have, but I would agree with you, Ed. I don't see at the present moment a lot of incentives going towards lateral and professional cooperation, and still much more to institutions, accountability, mandates, credit lines, and all these elements rather stiffen the sector than make it more flexible.
Really brings me to my last question, Peter, a brief one, and perhaps also a brief answer from your side. In the opening, I said something around, what happened in the interim, the moment the HERE board said, let's have a virtual conference, and where we are now. Now, I'm not asking you to have a crystal ball. How, however, would it be possible perhaps to retain, I don't know if I should call them gains, but the things we have learned because of this pandemic, and particularly the points you just mentioned in terms of, what I think is a new way of thinking. How do we make sure we retain the good elements of this pandemic, and that it's not business as usual that we go back to?
Well, I lobby heavily at the present moment states to really enhance, value those innovations which by force we brought into the humanitarian systems over the last couple of months. And I think you rightly mentioned, Ed, it's about incentives, it's about political direction, it's very frankly also about risk, because if you don't inject risk capital into the humanitarian market, which allows you to explore some of these innovations, to scale, to lead them forward, we will fall back into our traditional way of doing, or there is at least a danger that structures again get hold, and that some of the flexibilities we are going to lose them. So I think after this sort of trial and error period of a year of responding to pandemics, which has allowed us to test a lot of things, to navigate new ways, after this period, we will need political support for what has happened to happen on a more durable basis.
Thank you very much, Peter, for sharing your thoughts so openly. And I'm sure we will stay in touch with you and benefit from your wisdom. Thank you very much.
Thanks a lot to you. Thanks to all the participants. And I know that some colleagues from ICRC are there, and I'm sure they will feedback me about a great conference and great discussions. Thanks a lot to all of you, and have a good time over the next few days.